Most people think belly fat is just a cosmetic problem, a little extra weight around the waist, something that can be fixed with a diet later. But according to Dr. Maike, the can't see at a, this fat is called visceral fat, and it forms bile, con. Over time, this silent inflammation can set the stage for some of the most serious diseases of modern life: type 2 diabetes, heart disease, certain cancers, and even dementia. And here's the most alarming part: you don't have to be overweight to have dangerous levels of visceral fat. Many people who look perfectly normal on the outside may still carry this hidden metabolic threat inside their body. Dr. Michael Evans explains that the real danger of visceral fat isn't just where it sits in the body, it's what it does biologically. Visceral fat is highly active tissue. Unlike the fat under your skin, which mainly stores energy, visceral fat constantly releases inflammatory chemicals into the bloodstream. These substances include cytokines and metabolic signals that keep the body in a state of chronic, low-grade inflammation. And inflammation is exactly the environment that dangerous diseases thrive in. Dr. Evans often uses a simple analogy to explain this. Imagine a campfire that is almost burned out. The embers are still there, glowing quietly under the ashes. Now imagine pouring gasoline onto those embers. Within seconds, the fire explodes back to life. In the body, inflammation works in a similar way. If small clusters of abnormal or damaged cells already exist, something that can happen naturally as we age, chronic inflammation can act like fuel that helps those cells grow and multiply. This is why researchers have been paying close attention to visceral fat. Numerous studies have found that people with higher levels of visceral fat face a significantly greater risk of developing several types of cancer. These include colon cancer, breast cancer, ovarian cancer, lung cancer, and prostate cancer. In fact, scientists have now linked excess visceral fat to an increased risk of at least 14 different types of cancer. But the problem doesn't stop there. Visceral fat also disrupts the body's metabolism. It interferes with how insulin works, raises blood sugar levels, and contributes to conditions like metabolic syndrome and type 2 diabetes. At the same time, the inflammatory chemicals released by visceral fat can damage blood vessels, increasing the risk of heart disease and stroke. In other words, visceral fat doesn't just sit quietly inside the body. It actively changes the internal environment, pushing it toward disease. What makes this especially concerning, Dr. Michael Evans says, is that visceral fat can accumulate silently over many years. A person might look relatively healthy on the outside, yet still carry a significant amount of this hidden fat deep within the abdominal cavity. That's why understanding visceral fat and learning how to reduce it has become one of the most important topics in modern metabolic health. One of the most common questions people ask Dr. Michael Evans is surprisingly simple. How do I know if I have too much visceral fat? After all, this type of fat hides deep inside the body, surrounding the organs. You can't see it directly in the mirror the way you can see body fat under the skin. Scientifically, the most accurate way to measure visceral fat is with a DEXA scan, short for dual energy X-ray absorptiometry. This scan can analyze the composition of your entire body. It separates bone, muscle, and fat, and it can even show exactly where fat is stored. Doctors and researchers often use DEXA scans in clinical studies because they provide a very detailed picture of body composition. But Dr. Michael Evans explains that most people don't need advanced medical imaging to get a useful clue about their visceral fat levels. In everyday life, there is a much simpler indicator: your waist size. As visceral fat builds up inside the abdominal cavity, it begins to push outward from the inside. Unlike fat stored under the skin, visceral fat grows around the internal organs, gradually expanding the entire abdominal area. Over time, this internal pressure causes the waistline to increase. That's why a growing waist circumference can be one of the earliest warning signs of excess visceral fat. Dr. Evans often describes it using a very visual comparison. Think of your abdomen like a suitcase. The suitcase has a fixed outer shell, but if you keep packing more and more items inside, eventually the case begins to bulge outward. Visceral fat behaves in a similar way. As it accumulates around the organs, it stretches the abdominal cavity from the inside. This is also why people sometimes develop what is commonly called a beer belly. The belly appears firm and rounded because the fat is growing internally rather than just under the skin. So if your belt suddenly needs a new hole, or your pants feel tighter around the waist, that change may be more meaningful than the number on the scale. Body weight alone doesn't always reveal what's happening inside the body, but your waistline can provide an important signal that visceral fat may be increasing. After understanding what visceral fat is and how dangerous it can be, Dr. Michael Evans says the next question is obvious. How do we actually reduce it? The first and most important rule is surprisingly simple: avoid overeating. Visceral fat grows when the body consistently receives more energy than it needs. When extra calories are consumed day after day, the body stores that energy as fat. Over time, some of that fat begins to accumulate deep inside the abdomen around vital organs. This is exactly the type of fat that drives inflammation and metabolic disease. But avoiding overeating is easier said than done. Modern food environments make it incredibly easy to consume more calories than our bodies require. Portions are larger, meals are faster, and many foods are designed to make us want to keep eating. That's why Dr. Michael Evans recommends a few practical habits that can help people naturally reduce how much they eat without feeling deprived. The first habit is surprisingly visual. Leave space on your plate. When serving food, try to keep about 2/3 of the plate empty. Large plates filled with food encourage the brain to expect large meals. By reducing portion size from the beginning, you allow your body to recognize fullness sooner. The second habit is to let go of the idea that you must always finish everything on your plate. This tradition dates back to wartime periods when food shortages made waste unacceptable. Today, however, food is abundant in many places. Forcing yourself to finish every bite can easily push you beyond your natural hunger signals. The third habit comes from a traditional Japanese principle known as hara-hachi-bu, which means eating until you are about 80% full. Instead of eating until you feel stuffed, the goal is to stop eating just before complete fullness. This works because the body uses hormones such as leptin to signal satiety. When you eat slowly, these signals have time to reach the brain and tell you that your body has received enough food. If you eat too quickly, the brain often receives that signal too late, after you've already overeaten. By slowing down, paying attention to hunger cues, and stopping at about 80% fullness, you naturally reduce calorie intake. Over time, these small behavioral changes can make a significant difference in controlling visceral fat and improving overall metabolic health. For many years, coffee had a complicated reputation in health discussions. Some people believed it could raise blood pressure, disturb sleep, or even harm metabolism. But according to Dr. Michael Evans, modern research is beginning to reveal a very different picture. In fact, several studies suggest that coffee may actually help reduce visceral fat. One particularly interesting study followed adults over a period of several months to examine how coffee consumption affected body composition. Participants were divided into two groups. One group was asked to drink 4 cups of coffee per day, while the other group consumed a placebo beverage with similar taste, but without the active compounds found in coffee. Both groups continued their normal eating habits and daily routines. The researchers wanted to see whether coffee alone could influence metabolic changes over time. After 6 months, the results were striking. The group that drank coffee every day experienced an average weight loss of about 4.6 pounds. Even more importantly, scans showed a noticeable reduction in visceral fat, the dangerous fat stored around the organs. Meanwhile, the placebo group showed the opposite trend. Participants in that group actually gained about 4.4 pounds over the same period. This created a nearly 9-pound difference between the two groups, a surprisingly large shift for a single dietary habit. Dr. Michael Evans explains that coffee contains several biologically active compounds that may explain this effect. One of them is chlorogenic acid, which appears to influence how the body processes glucose and fat. Coffee also contains caffeine, a natural stimulant that can increase metabolic rate and encourage the body to burn stored energy. In addition, compounds such as caffeic acid have been studied for their potential role in reducing inflammation and supporting metabolic health. However, Dr. Evans emphasizes that the key point isn't that coffee is a miracle drink. Instead, it highlights how certain natural compounds in everyday foods can influence metabolism in subtle but meaningful ways. When consumed in moderate amounts and without excessive sugar or artificial additives, coffee may support the body's ability to regulate fat storage and energy use. Over time, these small metabolic advantages can contribute to reducing the buildup of visceral fat and improving overall health. After discussing coffee, Dr. Michael Evans points to another surprising discovery that comes from research on omega 3 fatty acids. For years, scientists have known that omega 3 fats support heart health and reduce inflammation. But researchers began asking a different question. Could omega 3s also influence body fat and metabolism? One study conducted in Iceland looked at how eating certain types of fish affected body composition over several weeks. Participants in the study were asked to include salmon in their diet 3 times per week for about 8 weeks. Salmon is considered an oily fish and is rich in marine omega 3 fatty acids. A typical serving of salmon contains more than 1,500 milligrams of omega 3s, which are known to support metabolic health. The results were remarkable. Over the 8-week period, many participants experienced significant weight loss, in some cases up to 15 pounds. Researchers also observed improvements in metabolic markers linked to fat burning. But what surprised scientists even more came in the follow-up research. The researchers decided to test a fish that is not considered oily at all, cod. Cod contains far less omega 3 than salmon, with only about 284 milligrams per serving. Most scientists initially assumed the metabolic effects would be minimal. However, the results told a different story. Participants who ate cod 3 times per week for 8 weeks still lost a noticeable amount of weight, averaging around 10 pounds during the study period. For Dr. Michael Evans, this finding highlights an important point about metabolism. The body does not always require extremely high doses of beneficial nutrients to trigger positive changes. Even moderate amounts of omega 3 fatty acids can support metabolic processes that influence fat storage and fat burning. Omega 3 fats appear to help regulate inflammation, improve insulin sensitivity, and support the activity of certain fat tissues involved in energy metabolism. These combined effects may help the body become more efficient at using stored energy, including visceral fat. The key takeaway, Dr. Evans explains, is that incorporating seafood into the diet, even relatively lean fish, can provide enough omega 3s to support metabolic health. Over time, these small dietary changes may help reduce the accumulation of dangerous visceral fat while supporting overall longevity. After discussing the role of omega 3 fats, Dr. Michael Evans turns to another powerful but often overlooked factor in metabolic health: dietary fiber. While many people associate fiber mainly with digestion, modern research shows that fiber plays a much deeper role in regulating metabolism, controlling appetite, and even influencing how the body stores fat. Foods rich in fiber include lentils, chickpeas, white beans, and other legumes. These foods have a unique advantage when it comes to managing hunger. Because fiber slows down digestion, meals containing these foods tend to keep you feeling full for much longer. This effect is known as satiety. Dr. Michael Evans explains that this satiety effect works on 2 levels. First, fiber physically expands in the stomach and slows the rate at which food leaves the digestive system. Second, it influences hormones and signals that travel from the gut to the brain, telling the body that it has received enough food. This means that when people eat fiber-rich foods earlier in the day, for example, beans or lentils during lunch, they often naturally eat less later. The body feels satisfied for longer, reducing the likelihood of overeating in the evening. But the benefits of fiber go far beyond appetite control. Fiber also acts as a primary fuel source for the gut microbiome, the vast community of beneficial bacteria living inside the digestive system. Scientists now believe that the microbiome plays a central role in metabolism, immune regulation, and long-term health. When fiber reaches the large intestine, gut bacteria ferment it and produce compounds called short-chain fatty acids. These molecules help reduce inflammation, improve insulin sensitivity, and support healthy metabolic signaling throughout the body. Dr. Michael Evans points out that this connection between fiber, gut bacteria, and metabolism may explain why diets rich in legumes and whole plant foods are consistently associated with lower body fat and improved metabolic health. In other words, fiber doesn't simply fill your stomach. It actively supports a healthier metabolic environment. By feeding the microbiome, regulating hunger signals, and reducing inflammation, fiber-rich foods can help the body gradually shift away from fat storage and toward better energy balance, an important step in reducing dangerous visceral fat. After discussing the powerful role of dietary fiber and the gut microbiome, Dr. Michael Evans highlights another everyday beverage that has attracted strong interest from researchers: green tea. For centuries, green tea has been consumed in many cultures for its refreshing taste and perceived health benefits. But modern studies are now beginning to uncover how it may also help reduce visceral fat. One clinical study conducted at the Isfahan University of Medical Sciences looked at women diagnosed with metabolic syndrome. These participants typically had several metabolic risk factors, including elevated blood pressure, higher blood sugar levels, increased cholesterol, and larger waist circumference, all signs that visceral fat was likely accumulating inside the body. The researchers divided the participants into two groups. One group was asked to drink 3 cups of green tea per day, while the other group consumed a placebo beverage that resembled tea but lacked its active compounds. The study continued for 8 weeks, allowing researchers to observe gradual metabolic changes over time. At the end of the study, the differences between the two groups became clear. Women who drank green tea daily experienced a modest but meaningful reduction in body weight, averaging about 2 pounds lost over 8 weeks. Even more interesting, researchers observed a measurable reduction in waist circumference, nearly 3/4 of an inch smaller on average. Because waist circumference is closely associated with visceral fat, this suggested that the participants were not simply losing water weight or muscle mass. Instead, they were likely reducing fat stored deep within the abdomen. The researchers also observed additional improvements in cardiovascular health. Participants who consumed green tea showed lower systolic blood pressure, which is the top number in a blood pressure reading. Lower blood pressure is associated with a reduced risk of heart disease and stroke. Dr. Michael Evans explains that these effects are likely related to the natural compounds found in green tea, particularly catechins and EGCG, which have been studied for their potential ability to support metabolism, improve fat oxidation, and reduce inflammation. Although green tea alone is not a magic solution, regular consumption may gently support metabolic balance. Over time, small improvements like these can contribute to reducing visceral fat and improving overall metabolic health. After discussing green tea, Dr. Michael Evans turns to another food that has attracted a lot of attention in recent years: apple cider vinegar. For a long time, many scientists were skeptical about claims that vinegar could help with weight loss. It sounded too simple, almost like a traditional remedy rather than something supported by real science. However, as new research began to appear, the picture started to change. One particularly interesting study conducted in Japan examined how apple cider vinegar might influence body composition and metabolism. Researchers divided participants into groups and asked them to drink different amounts of vinegar each day. One group consumed a low dose of 1 tablespoon, while another group consumed a higher dose of 3 tablespoons daily. A third group received a placebo. The study continued for about 1 month, and during that time, participants maintained their normal eating habits. The researchers carefully measured several health markers, including body weight, waist circumference, and levels of inflammation in the blood. By the end of the study, the results were clear. Participants who consumed apple cider vinegar showed a reduction in body weight, along with a noticeable decrease in waist circumference. Because waist size is strongly connected to visceral fat, this suggested that the vinegar was helping reduce fat stored deep inside the abdomen. Even more interesting, researchers observed a dose-response effect. People who consumed the higher dose of 3 tablespoons per day tended to lose slightly more weight and body fat than those who consumed the smaller amount. For scientists, this type of pattern is important because it suggests a genuine biological mechanism rather than a coincidence. Dr. Michael Evans explains that vinegar appears to influence how the body regulates fat storage. It may help improve metabolic signaling and reduce some of the inflammatory processes associated with excess visceral fat. The takeaway from these studies isn't that vinegar alone will transform someone's metabolism overnight. Instead, it shows that simple dietary habits, when practiced consistently, can influence how the body manages energy, fat storage, and inflammation. When combined with other healthy lifestyle practices, small changes like these can gradually shift the body away from storing dangerous visceral fat and toward a healthier metabolic balance. After looking at the surprising results from the apple cider vinegar studies, the next question, Dr. Michael Evans asks, is the same one many scientists ask when they see promising data. How does this actually work inside the body? In other words, what is the mechanism behind vinegar's effect on metabolism? The key compound responsible for these effects appears to be acetic acid, which is the primary active component in vinegar. In fact, from a chemical standpoint, vinegar is essentially a diluted solution of acetic acid produced through fermentation. Researchers studying metabolism have discovered that acetic acid may influence how the body manages fat cells, which are known as adipocytes. These fat cells act like tiny storage tanks for energy. When we consume more calories than our body needs, these cells expand to store the excess fuel, but studies suggest that acetic acid can interfere with this process in two important ways. First, it appears to slow the expansion of existing fat cells. Instead of continuing to grow larger as more energy is stored, adipocytes may become less likely to expand when acetic acid is present in the system. Second, acetic acid may also reduce the body's ability to create new fat cells. The body has the ability to form new adipocytes from precursor cells when energy storage demands increase. By limiting this process, vinegar may help prevent the total number of fat storage cells from growing over time. Dr. Michael Evans points out an interesting implication of this discovery. The beneficial effect may not come specifically from apples. Instead, it comes from the vinegar itself. That means other types of vinegar that contain acetic acid could potentially produce similar metabolic effects. Examples include red wine vinegar, white vinegar, rice vinegar, and traditional fermented black vinegar found in many Asian cuisines. Of course, Dr. Evans emphasizes that vinegar should not be seen as a standalone solution. Its potential benefits are most meaningful when combined with an overall healthy diet and lifestyle. Still, the research offers an important reminder. Sometimes small, simple ingredients that have existed in traditional diets for centuries can have surprisingly powerful effects on how the body regulates fat and metabolism. By this point, Dr. Michael Evans has explained how certain foods and beverages can influence visceral fat. But there is another factor that many people overlook entirely. It's not only what you eat that matters for metabolism. When you eat can also make a significant difference. To understand why, Dr. Evans explains how the body naturally switches between two metabolic states, fuel storage and fat burning. When you eat a meal, your body releases a hormone called insulin. Insulin helps move nutrients from the bloodstream into cells where they can be used for energy or stored for later use. During this period, the body's metabolism is primarily focused on storing energy, not burning it. But once you stop eating and several hours pass, insulin levels begin to fall. When this happens, the body gradually shifts into a different mode, one where it starts burning stored energy, including fat. This natural shift is an essential part of how human metabolism evolved. Our ancestors did not eat constantly throughout the day. Instead, their bodies regularly moved between periods of feeding and periods of fasting. Dr. Michael Evans suggests that modern eating habits often interrupt this natural rhythm. Frequent snacking, late-night eating, and extended meal schedules can keep insulin levels elevated for much of the day, leaving the body with very little time to access stored fat. One simple strategy he recommends is finishing dinner earlier in the evening and avoiding food afterward. For example, imagine someone finishes dinner around 7 p.m. and puts away the dishes by 8 p.m. If they go to sleep at 11 p.m., their body has already spent 3 hours without additional food before sleep even begins. Then, during 8 hours of sleep, the body continues operating in a low insulin environment where fat burning can occur. If that person waits another hour after waking before eating breakfast, they extend this natural fat burning window even further. Altogether, this simple shift in meal timing can create 10 to 12 hours each day when the body has the opportunity to draw energy from stored fat. Over time, giving the body more of these natural fat-burning periods may help reduce the accumulation of visceral fat and support healthier metabolism. As Dr. Michael Evans brings everything together, he points to a simple habit practiced for generations in one of the longest living populations in the world, the people of Okinawa, Japan. Okinawa is famous among researchers studying longevity because its residents have historically experienced unusually high life expectancy and lower rates of chronic disease. When scientists began investigating why, they discovered something interesting. It wasn't just about specific foods or nutrients, it was also about how people approached eating itself. One of the most well-known traditions in Okinawan culture is a phrase called hara hachibu. The phrase roughly translates to eat until you are 80% full. This principle encourages people to stop eating before they feel completely full. Instead of pushing the body to the point of fullness or discomfort, meals end when hunger has mostly disappeared but before overeating begins. Dr. Michael Evans explains that this habit works because the body needs time to recognize satiety. Signals from the stomach and digestive system travel to the brain through hormones like leptin and peptide YY, but these signals do not appear instantly. It can take several minutes for the brain to realize that enough food has been consumed. When people eat quickly or continue eating until they feel completely full, they often pass the point where their body actually needed to stop. Over time, this pattern can lead to chronic overeating and increased fat storage, including visceral fat. By stopping at about 80% fullness, the body receives enough nourishment while avoiding the metabolic stress that comes from excess calories. Researchers believe that this habit may contribute to several long-term health benefits observed in Okinawan populations, including lower rates of obesity, improved metabolic health, and reduced risk of age-related diseases. Dr. Michael Evans emphasizes that the lesson from Okinawa is not about strict dieting or deprivation. Instead, it's about developing a more aware and balanced relationship with food. When combined with the habits discussed earlier, drinking coffee or green tea, eating seafood rich in omega-3s, consuming fiber-rich foods, and allowing the body time to burn stored energy between meals, this simple principle can help create an environment where the body naturally stores less visceral fat. Over time, these small daily choices add up. They support healthier metabolism, reduce inflammation, and may ultimately help protect the body from many of the chronic diseases linked to visceral fat. After exploring the science behind visceral fat, Dr. Michael Evans emphasizes one final point. There is no single magic solution for reducing dangerous fat around the organs. Instead, the most powerful strategy comes from combining several small, consistent habits that gradually improve the body's metabolic environment. Visceral fat builds slowly over time, often the result of years of excess calories, chronic inflammation, and disrupted metabolic signals. Because of this, reversing the process also tends to happen gradually. But the encouraging news is that the body is remarkably adaptable when given the right conditions. Dr. Michael Evans summarizes the key habits that research consistently links to healthier metabolism and lower visceral fat. First, avoid chronic overeating. Simple strategies like leaving space on your plate, eating more slowly, and stopping at about 80% fullness help the body maintain energy balance without strict dieting. Second, include foods that naturally support metabolic health. Omega-3 rich seafood, even lean fish like cod, can help regulate inflammation and improve the way the body processes fat. These nutrients support cellular processes that encourage fat burning rather than fat storage. Third, beverages such as coffee and green tea may provide additional metabolic support. Compounds like chlorogenic acid, caffeine, and catechins have been studied for their ability to influence fat metabolism and improve insulin sensitivity. Fourth, build meals around fiber-rich foods such as beans, lentils, and legumes. Fiber not only promotes fullness but also feeds the gut microbiome, which plays a crucial role in regulating metabolism, immune function, and inflammation. Fifth, allow the body enough time each day to naturally shift into fat-burning mode. Finishing dinner earlier in the evening and avoiding late-night snacking gives the body several hours when insulin levels are low and stored energy can be used. Finally, small additions such as vinegar-based foods may support metabolic balance by influencing how fat cells grow and how energy is stored. Dr. Michael Evans reminds viewers that none of these strategies work instantly. Instead, their power comes from consistency. When practiced daily, these habits gradually reshape the body's metabolic signals, reduce inflammation, and help shrink visceral fat. In the end, protecting long-term health is less about extreme diets and more about sustainable daily behaviors. Over time, these simple choices can significantly lower the risks associated with visceral fat and support a healthier, longer life.